There is so much fear surrounding the use of tretinoin in the skincare community, partially because I feel like tretinoin, when it's prescribed by dermatologists, they usually don't give you enough information about how to use it. And the other fear is surrounding the potential side effects that come with the use of tretinoin. And this is especially true in the skin of color community, because for some people, when you get purging with tretinoin, it can actually cause more problems. And so there's always this apprehension about using this product. But it's an amazing product, especially for acne, hyperpigmentation, and for anti-aging benefits as well. So in this video, we're going to talk about how to use tretinoin in your skincare routine so you don't have to worry about all the potential irritation that can happen, and you can reap all the benefits from this amazing product. So stay tuned for the video. Hi everyone, my name is Dr. Degha Fongod. I am an aesthetic physician in the DC metro area, and my practice focuses on treating people of color. So how do you use tretinoin in your skincare routine? Firstly, it's important to understand that you want to use tretinoin at night, okay? So this is going to be part of your nighttime routine. First, you want to cleanse your skin, and you want to wait till your skin is dry before you can use tretinoin on your skin. Now, if you don't have sensitive skin, you can take a pea-sized amount, directly put it on your skin, rub it in, face and neck, and then you can put a moisturizer on top, and that's the end of your skincare routine. If you have more sensitive skin, or if it's your first time ever using tretinoin, then it might be a good idea to actually start with a small layer of moisturizer on your skin after you've washed it. And I would wait 20 minutes for that moisturizer to actually penetrate into your skin. Then you would use a pea-sized amount in the forehead, the corners on your cheeks, and then on your chin, and you rub it in all over. Don't forget to put some on your neck as well. And once that is settled and you wait a couple of minutes, maybe 10 or 20 minutes, you can add another layer of moisturizer on top. I believe that's called the sandwich technique, okay? So that's how I would suggest you use tretinoin in your skincare routine. Now, there are some areas that you want to avoid. So the corners of the eyes, the corners of the nose, and the corners of the mouth tend to be quite sensitive, and the skin is a bit thin in those areas. So I always advise patients to use Aquaphor or Vaseline in these areas, just to prevent any sort of migration of the product into that area and prevent any sort of irritation from happening. Now, if you're going to be using tretinoin in your skincare routine, there are certain products that you want to avoid using while you're using tretinoin. So products such as benzoyl peroxide, sulfur products, salicylic acid, or any other acids, AHAs, BHAs, resorcinol, you want to avoid these ingredients in your skincare routine at night while you're using tretinoin, mainly because it has the potential to cause further irritation. Tretinoin itself is already irritating enough. You don't want to add more to it. So I would avoid the use of these products with tretinoin in your nighttime skincare routine. In terms of the frequency of use, I would advise that when you first get tretinoin, start using it once a week. So the first week, use it, pick a day, let's say Monday, use it Monday night. And then the next week, you can start Monday night, and then maybe you do Thursday night, so 2 times a week. And then 3 times a week, 4 times a week, 5 times a week, okay? You want to slowly increase the frequency of use because you need to gauge how your skin is reacting to this product. Is it irritated? Are you having flaking? Are you having pain? Some people get a lot of pain with this. And so if you notice that your skin is not liking this product, then it's time for you to scale back and let your skin get acclimated to using it before you can further increase the frequency of use. So take your time with it. I feel like a lot of times when you're given this product, the packaging says to use it every night, and then so people use it every night, and then they have really bad results, or they get a lot of pain and irritation or purging, which is when you get like little tiny bumps or acne bumps. And if you have skin of color, then that's going to lead to hyperpigmentation, which is usually the side effect of the acne, and is the reason why you went to get the tretinoin in the first place. And so you're like, oh my God, this is making my acne worse. I don't want to use it. And so the best solution for this is to just take it slow. I think that's the best thing. Take it slow, start with once a week, go to 2 times a week, and then just see what your skin does and be patient with it, okay? It usually takes between 6 to 8 weeks for that peeling and irritation and purging to like really resolve. For some people, it takes longer, but you want to just bear with me and take this medication for at least 3 months so that you can start to see the benefits of the medication. Because like I said, if you have skin of color and you have acne, you tend to get hyperpigmentation as a result. And so this is really good for both acne and hyperpigmentation. And also it really helps to just keep your skin as smooth and even as possible. So great product. Just again, take it slow and you will get the benefits from this product. Now, patients always ask me whether or not they should continue using it when their acne resolves. And I will say yes, keep using it. If you can use it forever, I would say use it forever, okay? And the reason why this is important is because when it comes to something like acne, especially for women, it tends to be hormonal, right? So it's not like your acne is gonna completely resolve. Every month, you're probably gonna have a few spots that are gonna come up. So if you already have your tretinoin on board, then that's just going to help decrease the amount that you're gonna get, and it's gonna help you manage the hyperpigmentation that can come with that. On top of that, we all know that it helps with anti-aging, so it helps with fine lines and wrinkles. If you start using tretinoin early on, then you have a head start. Basically, you're working your skin out. It's like exercise for your skin. By the time you hit your 40s and 50s, your skin is gonna look amazing. And so there's really no good reason why you should stop using it if your skin is not irritated. So once you get tretinoin on board and your skin is happy, I say continue using it. Now, you might have to stop during pregnancy, which is important because you don't want to compromise the health of your child. But once you're done with pregnancy and breastfeeding, you can always resume the use of tretinoin in your skincare routine. So I hope this video is going to calm all of your fears about using tretinoin. I want to encourage you to use it for acne, hyperpigmentation, for anti-aging purposes, and now you know how to use it in your skincare routine. If you have any other questions about tretinoin, make sure you leave them in the comments below. And if you have suggestions for videos that you would like for me to do next, then also let me know in the comments below. I hope you enjoyed this video. I'll see you on the next video. Bye.